I'm so happy to be here today with Alyssa from Greenhaven Massage Therapy. She is going to tell us all about what she does with pregnancy and postpartum moms. So welcome, Alyssa. Thanks for joining us.
Hi, thanks for having me. I'm so excited to be here.
I'm excited you're here too. So could you just start off with telling us a little bit about who you are and what you're doing?
Yeah, sure. So my name is Alyssa, and I am a registered massage therapist. I have been a registered massage therapist for 8 years now, and I am also the owner of the newly opened clinic, Greenhaven Massage Therapy, here in the West End. Previously, I co-owned More to Life Massage Therapy in kind of the central location of Kingston. And I've focused a lot of my career on working with people in reproductive health. So I work not only with moms who are pregnant and expecting, but also I provide massage therapy to postpartum moms. And I also specialize in our Vigo Mayan Abdominal massage, which is a special technique that we work with the abdominal area, not only with reproductive organs, but also with intestinal health, diaphragm, those kinds of areas. And in addition to that, I was a doula on and off for about 7 years.
That's amazing. Well, I know I met Alyssa through my own pregnancy journey with my youngest son. I remember messaging you one Saturday morning saying, I can't walk, I need your help. And you were so quick to get me in. And you made such a difference in my pregnancy journey. So I'm so happy to be able to come back together in this realm and be colleagues as we're working with women at this time of life. So I would love to hear a little bit more because I know personally what you can do for moms, but I would love to hear more about massage therapy specific. I want to get into the abdominal massage because I'm so interested in that, but I want to hear more about massage therapy and how is it so beneficial for moms or women who are pregnant or newly postpartum.
Oh gosh, that's a big question.
I know it is.
So I guess the basis for, let's just talk about pregnancy first and separate that from the postpartum because there's benefits both ways. So with pregnancy, there's so many changes happening in the body in a very short amount of time. We've got about 9 months roughly to grow a whole new person. And what happens to the body is it shifts around quite a bit. So we see some really common things happening like sciatica, sacroiliac joint issues. So that's the joint at the base of your spine. So a lot of hip pain. Some people will get carpal tunnel. Some people will get calf cramping. And then a lot of people are just dealing with the regular symptoms of being pregnant. So things like, more fatigue. That's really common in the first trimester. People are tired. They're dealing with low back pain or hip pain or even some neck and shoulder stuff because your posture is changing quite a bit over those 9 months.
That's right. And so do you find that you see your clients over a number of sessions or can some moms get some benefit just from a one-time session? What does that look like?
Yeah, so it really depends on the person and their own pregnancy journey because I might see maybe one person once during their pregnancy just for a relaxation massage and they're doing totally great. They feel all glowy, like the typical thing we hear about pregnancy. But I would definitely say that's a minority for who I see. I tend to see people whenever their symptoms start. So that could be really variable. Some people will get things like sciatica in the first trimester because our bodies are releasing that relaxin hormone, and relaxin helps all of our joints get really stretchy. And if there's any kind of underlying issue that's not bothering them like before they were pregnant, once that hormone is released and those joints start to be a little bit lax, then they might get some symptoms of sciatica earlier on. And then on the other hand, I might see people, when they're in their third trimester and they're getting to that point of, I'm so sore, I'm tired of being pregnant, everything hurts, I can't sleep. So it really depends on the person, and we can adjust your treatment plan to work with whatever works for you. Some people like to, wait until they're farther along to get closer appointments together, where other people like to have consistent appointments throughout their whole pregnancy as a form of self-care and using their health benefits.
That's great. Now, for somebody who may not have ever had a massage or never had a massage when they're pregnant, how does that look? Because obviously women are very concerned about having to lay on their bellies, or what accommodations are you able to provide for moms who are pregnant and in later stage?
Yeah, so this is where I like to joke that I am the massage therapist with 1 million pillows, because I want to be able to massage anybody in whatever position they're comfortable in. And I'm very flexible with that. So oftentimes I have a pregnancy pillow, and this is a specially designed pillow that lays on the top of the table, and it creates a divot in it so that you can lay on your tummy. And a lot of people are comfortable in this anywhere from 20-ish weeks, 15 to 20 weeks, all the way up until like their due date or past that. However, every belly is different. So everybody carries their baby a little bit different. Some people have twins. So I like to also have the option of being able to lay on your side. So then you can lay on your side, and I have a big long body pillow that you can hug and tuck under your belly, put in between your legs so you're nice and comfy. And we can still do a full body massage in this position. I also have a big wedge, which every time anybody lays on it, they're like, why don't I have one of these? And I'm like, you have to order one. And once you're turned onto your back, we know that you're not supposed to be on your back past a certain stage in your pregnancy. So this elevates you so that you're like semi-seated. And it's really great for when you're really pregnant, and also if you're having like heartburn or anything like that. Right. So those are all of my pillows that I have at my disposal to make people comfortable.
That's so great. So you've talked a bit about the physical health conditions, but do you ever see anybody that's just strictly for mental health for massage?
Yes. Yeah, totally. Actually, right now during the pandemic, I'm seeing more and more of that, not just in pregnancy, but in my entire practice. Right. People are really entering that chronic stress stage because we don't know what's happening, and we're still dealing with all of the, issues around this pandemic. So
a year later.
Yeah, a year later, it's really taking a toll on people's bodies. So I do see a lot of people in just for mental health. And as a person who has my own mental health issues around depression and anxiety, I just love creating a space for people to come and feel welcome no matter how they're feeling. And, people tend to brush off like relaxation massage, but there's so many benefits of it. We know that it can really help kick in hormones of relaxation. It can help boost some of that like oxytocin and serotonin in people because of the physical aspect of touch. Yes. And it also gives people a place where they can just let go of everything and have somebody else take care of them for like a full hour, which is very rare nowadays in our society. We're so busy.
Mm-hmm. I love that concept of somebody just taking care of you for an hour. Mm-hmm. What an incredible thing to expect or experience when you go into a massage. I certainly don't think that's a reason why many people gravitate towards massage. I think a lot of it is from physical ailments. But in this world where we are so feeling so much more stress and anxiety, and like you said, not just moms, but anybody in general, to be able to just go and have a massage and know that they don't need to be responsible for anything for a half an hour. They can just be in your capable hands and just let go and release and feel that relaxation and be looked after. So how are you functioning for massages right now, considering pandemic times that we're in?
Yeah, so right now we are still able to fully operate. The really neat thing that a lot of people don't know about massage therapy is that it is actually a regulated healthcare profession. So that means we have the College of Massage Therapists of Ontario, and they're responsible for outlining all of our standards of practice. And they've got some really strict standards around things like cleaning, screening people, tracking who's been in and out of your clinic, and also, what type of cleaners we use, and also our own protective personal equipment. So currently, everybody, when you're getting a massage, needs to wear their mask. You need to screen negative for COVID, and we make sure to send these screenings out at least 36 hours before your appointment. Right now, we're not charging any cancellation fees for last minute appointments due to symptoms or illness because we are living in a pandemic. And we also, in addition to that, I will often wear a face shield while I'm working as well.
Okay. I think that's good to know, because as we here in Kingston start opening up a little bit more, I think there's certainly some apprehension of getting back into these regular appointments we may have had prior to. So it's really great to hear that precautions are being taken and people can feel safe and confident coming and having a massage and looking after their self-care and their mental health and physical health. I just want to touch on a bit, because I'm very interested in hearing more of the abdominal massage work that you do.
Yeah.
I know, talking to you previously, you were mentioning some of the benefits for endometriosis and PCOS and many other reproductive concerns that women might be facing. Would you mind talking about that just a bit and enlightening me? Because I'm so curious to hear more.
What I do is called our Vigo Mayan Abdominal Therapy, and it is a technique that was developed by two people. One was Dr. Rosita Arvigo, and she is a naturopath that went to Belize. And when she went to Belize, she met Don, I can never say his name, Don Ilojo. I'm terrible at that. I'm sorry.
You can Google it.
But he was a traditional Mayan healer, and he had learned these techniques from generations passed down to him. And she would see him working with women and helping their reproductive concerns simply by working with massage and traditional herbs and remedies. Now, I'm not allowed to do traditional herbs and remedies because those are out of my scope of practice here in Canada, but I do still provide the traditional Mayan abdominal massage. And so I am a person who suffers from polycystic ovarian syndrome. And as a result of that, I have very painful periods. And sometimes it's so bad I can't even get out of bed and I have to take the day off. So as I worked with people during pregnancy and postpartum, I really felt there was kind of like this missing gap in reproductive health in general. So I decided to take the course, and I really loved it. So I want to be really clear with people. So if you have an underlying condition like polycystic ovarian, endometriosis, any hormonal disorders, massage therapy alone isn't going to reverse that. What I'm really working with people is adding another layer to their healthcare in order to decrease their symptoms if possible, and also create a lot of really good blood flow and balance through the organs of the abdomen. So when we're working with somebody through our Vigo, we're checking a lot of different things. We're checking, how is digestion working? What are your symptoms of menstruation, like in your cycle? What do those look like? Do you have any food issues? We're also looking to see if there's any incontinence or prolapse issues. So we're really doing a really deep dive with your history. I like to assess for those things that we can feel as massage therapists, like, is there a bit of restriction in this area? Is there scar tissue here? Is there something that should be moving well and it's not? And we can also work a little bit with people when it comes to like minor prolapses and helping them to manage some of the symptoms on their own. We teach people the massage to do at home as part of their own self-care. And when it comes to polycystic ovarian and endometriosis, there's been some really interesting studies by other RVGO practitioners. And these are just studies they have done. They're case studies. I want to be clear, they're not like medically funded studies that way. But basically, the idea that we've found so far in the studies that they've done is sometimes with polycystic ovarian, there's been relief from small to medium-sized cysts on the ovaries. When it's large cysts, there's not as much evidence to provide that like massage alone will help that. But some people have found that regular RVGO treatments can help with small cysts on the ovaries. And then there are also people who have had endometriosis, and endometriosis is when the lining of the endometrium in your uterus comes out and it lands on other organs. And I mean, we're still trying to figure out how exactly this happens. We know that it happens, but they've got a couple different theories about why endometriosis occurs. But basically, when you have that endometrial tissue on other organs, it can land on the bowel, it can land on the bladder, it can land on the ovaries. Then every time you have your cycle, it's going to respond the same way as the lining of your uterus. So it can lead to scar tissue, it can lead to chronic inflammation around the bowels. And a lot of people may end up having to do laparoscopic surgery to remove some of this scar tissue in order to stop having such painful periods and also symptoms. So where massage therapy falls with that is we're not necessarily getting rid of the scar tissue. However, where I like to come in and approach it is, how can we get things moving well through those organs so that when you are having your cycle or when you're walking around all day, so that it's not pulling as much. It's almost like you take the scar tissue and you just gently lengthen it regularly so that, you know, things don't feel as stuck. And some people will find that this really helps some of their cramping and their symptoms, and other people might not find so much, but it's always worth a try as a self-care tool that you can use at home to help manage that. So that was a lot of information. I'm sorry if that was too much.
No, it's never too much. Thank you for sharing all of that.
I don't just see people for our Vigo therapy. I also incorporate it into my regular practice often if people are having constipation or diaphragm issues. There's so many things that you can accomplish with abdominal massage that people don't realize.
If anybody wants to get in touch with you, how could they go about doing that?
So you can check out our website, so greenhavenmassagekingston.com, or you can just email me. My email is my full name at gmail.com. So that's alyssarosegreen@gmail.com, ALYSSA, rose like the flower and green like the color.